in this video we are going to talk about anemia in pregnancy. So normally in pregnancy, if you see, all parameters which are related to iron metabolism will decrease in pregnancy. But if you take example of serum transferrin and total iron binding capacity, only this both will increase in pregnancy, but all others will decrease. All the parameters which are related to iron metabolism will decrease. Only serum transferrin and total iron binding capacity only will increase. So as we said, all parameters will decrease, even the hepcidin will decrease. But when hepcidin decreases, what happens is the iron which is transferring from the enterocytes to the maternal circulation by means of ferroportion. So actually ferroportion is present on enterocyte and it drags more iron from the GI system to the maternal circulation when the hepcidin drops. So all parameters are dropped, even hepcidin is dropped, and only serum transferrin and total iron binding capacity is increased in the case of anemia in pregnancy. So now let us see what is the total amount of iron which is required actually in pregnancy. The total iron required in pregnancy is like about 1000 milligrams. Okay, so you require 1000 milligrams, and the fetus alone requires 300 milligrams of iron. And during pregnancy about 250 milligrams of iron is lost. So 250 milligrams of iron is lost, 300 milligrams of iron is completely required by the fetus, and total iron in pregnancy is about 1000 milligrams. So you require 1000 milligrams of iron if you see in a total pregnancy. Okay, so daily requirement of iron in pregnancy. So daily how much you need in pregnancy, that is like about 4 to 6 milligrams per day. So daily you need to have at least 4 to 6 milligrams, especially in the time of pregnancy. So now let us see according to the trimesters what is the need of iron. So to remember this, you can remember like 1 to 4 5 6. Okay, 1 to 4 5 6, just 3 is missing. Okay, and just milligram per day. So for first trimester you need 1 to 2 milligrams per day, for second trimester you need 4 to 5 milligrams per day, and for third trimester you need 6 milligrams per day. Okay, so this is the thing we need to remember. And next, coming to amount of iron which should be taken in a diet. So in a diet daily you require 40 to 60 milligrams per day. Even though you take 40 to 60 milligram per day, only 10% of this iron is going to absorb by our GIT, right? So dietary iron, only 10% will get absorbed. So that's why we need to take a supplementation of iron in pregnancy. So supplementation of iron is mandatory in pregnancy, because even though you take 40 to 60 milligrams of dietary iron, only 10% is going to absorb, right? So there is also an program which is going on in India, that is the Anemia Mukt Bharat. Anemia Mukt Bharat is a program where government is giving the free tablets of iron, which is containing like about 60 milligrams of elemented iron. Okay, elemented iron with 500 micrograms of folic acid. So folic acid is also required because especially in the first trimester time, folic acid is required to prevent the anencephaly and neural problems, right? So folic acid is also given by Anemia Mukt Bharat with 60 milligrams of elemental iron and 500 micrograms of folic acid. Now coming to this Anemia Mukt Bharat, this program, we need to start this program only after 4 months of pregnancy. Why? Because before 4 months of pregnancy, only if you take folic acid, that would be more than enough. But after 4 months of pregnancy, you should start taking even the iron. Okay, so that's why this should be started after 4 months of pregnancy and should be continued throughout the pregnancy, and also 180 days after delivery. Even after delivery, you need to take 180 days after delivery. Okay, so why we are taking this after delivery also? Because we want to replenish the iron contents. Okay, so this program is actually uh, it's a prophylaxis program. It's not for already anemic patient. It's a prophylaxis program to not get anemia during pregnancy. This prophylaxis program, in this we give one pill per 1 day. So after 4 months of pregnancy we give one pill of iron tablet with folic acid for 1 day. Okay, this is a prophylactic program for non-anemic women. And in non-pregnant female, even in non-pregnant female, we can take one pill of iron tablet per 1 week, not daily. In already pregnancy, they should take daily, even though they are non-anemic. But in non-pregnant female, even though they are non-anemic, it's better to take one pill of iron and folic acid for 1 week. Okay, and next, coming to the patients who are planning for pregnancy. If someone is planning for pregnancy, then they should stop taking iron. As I said, they should only take the folic acid, that is B9. The folic acid is required before 4 months. Till before 4 months of pregnancy, continue folic acid, but from the 4 months of pregnancy, start adding even iron. And even after delivery, that is after 180 days after delivery also, we need to continue the iron and folic acid tablets. Now let us discuss the anemia in pregnancy. Actually, the anemia in pregnancy is divided into two types. One is physiological anemia, one is pathological anemia. So what is physiological? Means it's a normal anemia, that is the hemoglobin here is reduced mainly because of hemodilution. Because of hemodilution, the hemoglobin is reduced, but it is reduced, it will never reduce less than 11 grams percent. Okay, so it will never reduce less than 11 grams. That's why it is called physiological. But in pathological anemia, what happens is the hemoglobin will drop less than 11 grams percent. It will drop less than 11 grams. Okay, so that is why it is pathological. So according to WHO, we say anemia in pregnancy is when hemoglobin is less than 11 grams. Okay, and if you say it is severe anemia, then it is less than 7 grams percent. And if it is very severe, then it will be even less than 4 grams. So this is a very severe anemia. Okay, so now let us say according to the trimester, how much of hemoglobin is dropped and how much of hematocrit is dropped. So according to first trimester, there is less than 11 grams of hemoglobin and also less than 33% of hematocrit. In second trimester, there is less than 10.5 gram percent, and that is less than 31 to 32%. And in third trimester, there is less than 10.5 to 11%, and there is less than 33%. Finally, after post delivery, hemoglobin will less than 10% and here less than 30%. So this is about hematocrit. Okay, hematocrit values, and this is about hemoglobin values. Okay, so this is important. In first trimester, hemoglobin is less than 11 grams and hematocrit is less than 33%. In second trimester, hemoglobin is less than 10.5 grams, hematocrit is less than 31 to 32%. In third trimester, hemoglobin is less than 10.5 to 11% and the hematocrit is less than 33%. In the third trimester, less than 10.5 to 11% and less than 33%, and post delivery less than 10% and less than 30%. Okay, so this is very important. Now let us see iron deficiency anemia. So especially the most common anemia which you see in pregnancy is, of course, iron deficiency anemia, IDA in short, iron deficiency anemia. It is most common in pregnancy. So this type of anemia is actually, it's microcytic and it is also hypochromic anemia. It is microcytic and hypochromic anemia, and here the MCV values will be less than 75 femtoliters, and here the MCHC values will be less than 30%, and this is the most sensitive RBC index. This is the most sensitive RBC index, that is MCHC less than 30%. Okay, now coming to serum ferritin levels. The serum ferritin level will be less than 30 micrograms per DL, and this drop in serum ferritin is in earliest It's the earliest and also most sensitive marker. So what is the most sensitive and earliest marker which you see in iron deficiency anemia? That is serum ferritin level is less than 30 micrograms, and MCHC if less than 30%, it is the most sensitive RBC index. So most sensitive RBC index also 30. Here 30 micrograms, here 30%, here 30 micrograms is the earliest and most sensitive marker. Okay, so what is the best investigation for iron deficiency anemia? The best investigation is serum ferritin level. So when the serum ferritin levels drop less than 30 micrograms, it is the best investigation of iron deficiency anemia. So in iron deficiency and anemia, all these are dropping, but three values are increasing. What are those three values which increase in iron deficiency anemia? That is, the first one is TIBC, that is the total iron binding capacity will increase, and also the red cell distribution width will increase. Okay, and also erythropoietin levels will increase. So what are going to increase? Serum ferritin will decrease. Three values are going to increase. Total iron binding capacity will increase, red cell distribution width will increase, and erythropoietin levels will increase. So what is the screening for anemia in pregnant female? In pregnant female, how you will screen for anemia? So in pregnant female, you need to do it in all pregnant females, and we need to do the complete blood count, and also it should be done in a first antenatal visit and should be repeated at 24 to 28 weeks. So first antenatal visit and repeated at 24 to 28 weeks, you should repeat it. And the treatment for this iron deficiency anemia, the treatment is you need to give oral 2 iron folic acid tablets, 2 tablets for 1 day. So here this is anemic patient, this is a pathological, so we will giving 2 tablets. But if you remember in Anemia Mukt Bharat, we are giving only 1 tablet per 1 day, because here the female is non-anemic. It is a prophylaxis, but here the treatment, because already there is iron deficiency, so we are giving oral 2 tablets per 1 day. And hemoglobin increases after 3 weeks. By giving this tablets, immediately it will not increase the hemoglobin. By giving this tablet, after 3 weeks, you will see there is increase of 0.7 grams per DL per 1 week. So for 3 weeks, you can say 0.7 into 3 weeks, then you will understand how much it will increase, right? So for 3 weeks, 0.0 gram per DL will increase per 1 week. And when hemoglobin reaches the target, so when hemoglobin has come to 11 grams, for example, in this patient, then continue, even though it has come to 11 grams, continue 1 oral tablet per 1 day. Okay, continue with 1 oral tablet with 1 day, and also throughout the pregnancy, of course after 180 days after delivery also continue. So the first parameter, so now you are giving iron tablets to your patient. So after giving iron tablets, what is the first parameter which increases? That is the reticulocyte. So how you understand that the tablet which you have given is affecting? That is by reticulocyte count. The reticulocyte count is rise in 7 days or even in 10 days. So either by 7 to 10 days, reticulocyte count will rise. And the most common side effect by this oral tablets is you can get gastritis. Okay, so by this we completed part 2 of anemia in pregnancy. Next we'll start with part 1 we completed. Next we'll start with part 2 of anemia in pregnancy.